For many people who suffer a brain injury, they are never quite the same and require months and years of rehabilitation, oftentimes to relearn many of the things they always did with ease, like walking and talking. Let's welcome Michelle Moore, speech-language pathologist and certified brain injury specialist. It's good to have you.
Thank you.
We've talked about brain injury here on this show and recently, but when you're talking about the things that people really do take for granted, such as walking and talking, I would imagine that's a very frustrating road to travel once you've suffered a brain injury.
Yes, it is. The brain controls literally everything we do. Talking, eating, balance, how you move, and the recovery process, it can be long and difficult, so it can definitely be a frustrating time for folks who are recovering from a traumatic brain injury.
And when we're talking about speech pathology, so what is the process to getting someone to talk again or the way they once did?
Sure. So a lot of people don't know that speech-language pathologists, we do more than just speech. We also work with individuals on their cognition, so things like concentration, memory, as well as those communication and speech skills. So after a brain injury, the brain doesn't heal like a cut on your hand where new cells grow and the cut is healed. The brain doesn't have the ability to make new cells. So what happens after a brain injury is a roadblock, and the brain can no longer communicate with the muscles or with the memory center of the brain. And so what we do in all therapies, speech as well as physical and occupational, is we try to facilitate a process called neuroplasticity. And this is like a detour around that roadblock. It can be a long process, it can be difficult, and for some people, depending on their age and the severity of their brain injury, that recovery process may be incomplete, leaving them with permanent impairments from their injury.
So like breathing, speaking is not an involuntary reaction.
Right.
So it's relearning how to use the muscles in your jaw and your mouth, your tongue, getting the thoughts from the brain to the mouth.
Yes, all of those things we address in therapy.
Yeah, and what is the road, how long is that road usually?
It varies greatly depending on severity of injury and age. It can take weeks to months to years. We know that the brain recovers fastest in the first year after injury, but there's research out showing that people can continue to recover for years after injury.
Gosh, is there anything that people can do, whether it's a change in their diet, to just kind of help the synapses in the brain start to repair themselves? And
yeah, so what we know about that neuroplasticity process, about helping the brain get better, is that early intervention and then working on things that are meaningful and functional to their brain. So after injury, we focus on tasks that the person used to enjoy or that are meaningful, like work-related tasks, to help their brain recover.
Okay, and how many people suffer from brain injuries here in South Carolina, for instance?
So the national average is 1 in 60 people are living with a disability related to traumatic brain injury, but that doesn't capture those who have non-traumatic brain injuries as well, things like lack of oxygen to the brain from cardiac arrest or drug overdose or things like seizures. So the number is quite high.
Gosh, and who is most prevalent to these brain injuries? What are some of those common causes?
Sure, so the leading cause of traumatic brain injury in South Carolina is falls, and that's most likely to impact the elderly and young children, and then the second leading cause is motor vehicle accidents.
And we're talking about young children. Children fall down all the time, especially when they're young and they're first learning to walk and get their sea legs. So would their brain be able to repair faster?
Yes.
Okay.
Yes, so the younger a brain is, the more capability it has to heal and to recover. So children do tend to have a faster and a more complete recovery than an older brain.
Yeah, and what advice do you have for people who are living with someone who has a severe brain injury, that just to impart some words of wisdom on patience and how to help, how to be of service to that person?
Yes, caregiving can be a full-time job when you're taking care of someone with a brain injury. I always encourage people to seek support, whether that's formally through a support group, whether that's through friends and family, because you have to take care of your own well-being in order to be there for the person that you're taking care of.
And ways to prevent brain injury.
Sure. Yeah, so a few pretty simple prevention tips. One related to falls is to make sure that your space is clutter-free. So if if you are older or if you have any type of mobility impairment, you want to make sure that you don't have throw rugs or any clutter in your path, grab bars in your bathroom, non-slip surfaces in your showers. For children and falls, when you're looking at their play spaces, when they're playing from an elevated height, you want to make sure they're supervised appropriately and that the surface under the playground area is something shock absorbent like rubber or mulch.
Yeah, all right, perfect. And it's important to note that Roper St. Francis Rehabilitation Hospital downtown in Charleston is one of only 2 in the state. So for more information, we'll put that information on the screen. Michelle, thank you so much for your time.
You're welcome.
Appreciate it.
Thank you.
We're back after this.